Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuvir Deshpande from Pune, Maharashtra State, would like to welcome you all in my Ayurveda Academy YouTube channel. As everybody knows that I am MD in Ayurvedic Medicine and MD in Ayurvedic Physiology. For paid online consultation, my WhatsApp number is given in the description, that is 9226810630. This is the series that is related with Ayurveda in GP or Ayurveda in general medical practice. So nearly 60 videos I have planned to upload, and I think nearly 45, 50 videos have already been uploaded till this date. So I hope that everybody will get the benefit of this knowledge sharing and experience sharing. So let us continue the previous videos discussion, which was, this is a part 2 of STD or sexually transmitted diseases and the sexual problems. So in the first part, we have discussed about the syphilis, about the gonorrhea, and about the chancroid. And also we have discussed about the nocturnal emission and the masturbation, which at specific age supposed to be normal behavior. The third point is nowadays facing with the different IT people because of the lot of stress in the mind, and also not having the enough time with each other in the couples. So let us discuss about this problem of impotency. Impotency is also called as the ED problem. I have already uploaded many videos related with the sexually problems, and sex guide is a playlist. You can check each and every video on that. I have discussed about the interesting solutions for impotency. For example, Tentex Forte tablet or Confido tablet from Himalaya. I have a drug review of all these videos, like Makaradhwaj, for example. Most of the times, this impotency or erectile dysfunction, this simply means when the partner is performing the intercourse, the male partner doesn't get the enough erection to the penis, and also sometimes it may not be adequate time, that particular erection or the hardness of the penis. So let us see what are the causes and investigations and the management. Most of the time it is related with the brain or psychological stress. Many times physical problems are not found by doing a lot of tests. These diseases in which impotency can occur is a diabetes mellitus, especially uncontrolled diabetes mellitus. If your blood sugar is not controlled, then this problem may occur. Then sexually transmitted disease like syphilis also can give the problem like impotency or erectile dysfunction. Now, iatrogenic, that means because of the faulty medication, or not faulty, but some side effects or complications of the medicine, some anti-hypertensive medicines which will control your blood pressure can create temporarily this impotency problem. Temporarily, if you change the medicine, if you withdraw the medicine, problem will go automatically without any another particular treatment. Impotency can arise due to the chronic alcohol intake. So be careful from the vices like no alcohol, no smoking, etc. Let us go further. What type of the investigations? Because this is, you have to diagnose that this is not secondary, this is primary. To rule out that it is not secondary, you must do some investigations. Fasting and post glucose blood sugar to rule out the diabetes mellitus. If the patient is known diabetic, then fasting and post prandial, that is after lunch. But if patient is not known diabetic, then better way you do the fasting and post glucose after giving sharbat of 75 gram of glucose in the laboratory blood investigation. Then there is a glycosylated hemoglobin, HbA1c. So you have to do this particular test to give the last 3-month average in the diabetic patients. Then you can do the blood test VDRL to rule out the syphilis or sexually transmitted disease. Treatment, first you have to Sanshepataha Kriya Yogo Nidana Parivarjanam to rule out, find out the cause and treat the basic cause if it is there. For example, if diabetes, must try to control the blood sugar. If it is syphilis, take the adequate treatment by benzathine, penicillin, etc. Long penicillin, long acting penicillin. And if you are drinking alcohol, stop that alcohol and smoking. Then home remedy, onions after pricking can be kept in honey for a month, and those can be consumed one small onion or small petal of the onion every day. not whole onion. Or you can consume some medications like Tentex for Himalaya company, 2 tablets 3 times in a day, with Khurasani Ova to mental tranquility is there, 125 milligram 3 times with ghee. Another prescription, my dear friends, for impotency is Makaradhwaja tablet from Baidyanath, 1 tablet each morning with milk. Then Kauncha Pak from Hari Parshuram Aushadhalaya, Ayurvedic pharmacy from late Khadiwale Vaidya. His son, Vinayak Vaidya, is still practicing near Raman Bagh School in Pune, Shanwarpet. So 3 teaspoons 2 times in a day. Then Afrol Fort, Dudh Papeshwar Company, 2 tablets 3 times in a day. Another prescription, Dr. Deshpande is giving you the lot of scope with the different medicines which are available at your place or can be demanded by internet. Even the Bhasma, 125 milligram 3 times in a day with honey. Suvarna Makshika Bhasma, 200 to 500 milligram 3 times in a day with honey. This may be given if the patient is anemic, less hemoglobin or less RBC. Then Allersen Company, Fortis tablet, 2 tablets 3 times in a day. Next prescription, my dear friends, for impotency, you can have look on this tablet. Pelvin Fort tablet is available. 3 tablets first at a stat dose and then 2 tablets 2 times in a day. Then Mustang from TTK company, 2 tablets 3 times in a day. Vanari Kalpa from Sandu company, 2 teaspoons 2 times in a day with milk. Now next, last prescription for impotency or erectile dysfunction. Vigorex tablet from Jhandu company, 2 tablets 3 times in a day. Pimpix of Sandu company. These are different companies. 1 tablet 2 times in a day. And Musali Pak 6 to 12 gram 2 times in a day. After this impotency problem, we will discuss the main genuine problem of today's era is infertility, having not getting issue after 1 year of successful marital life. Both the terms, infertility and sterility, this has a definition: inability to conceive after 1 year of sexual life without using any contraception. This is official definition. The couple is doing regular sex without condom, etc., but still they are not getting the child. Sterility means the absolute state of inability to conceive, while infertility means relative state of failure to conceive. Okay. Faulty male causes. These are the causes. For example, the husband, he may have the systemic factors like aging over 45 years, naturally the testosterone level will come down, and spermatogenesis, formation of the sperms process, will not be normal. Then you have to check the semen sample. In the infertility case, my request to every viewer that whenever there is not getting the child problem in the couple, in the rural areas, they always blame to the female. They always blame to the wife. But this is totally, absolutely ridiculous. So, my dear friends, in infertility cases, the first investigation Professor Deshpande's advice is semen examination. Even no necessary to do clinical or in laboratory test of the female partner to begin with. If you feel that the semen is absolutely perfect, for example, there is no oligospermia, azoospermia, the sperm count is 80 to 120 millions per cubic mm, fantastic motility, fructose is present, abnormal sperms are not there in the semen, then you can go for the female. But before that, even you can check testosterone level. Then you go for the female and check the endocrine assay and also the sonography, etc. Okay. So male factors are severe diabetes, uncontrolled diabetes, extreme obesity, then fatigue, heavy smoking, alcohol may work through the impotence because patient may have the infertility problem and because of that they are not getting the child. Then endocrinopathy factors, for example, pituitary infantilism, hypothyroidism, thyroid function is less, adrenal hyperplasia. These particular endocrine problems work through the defective spermatogenesis. Sperms will not form normally. Then you have to do the semen examination begin with. Some psychological factors, nervous tension about the sexual activity performance, fear and psychiatric illness may cause impotency. Immunological factors, sperms auto-agglutinating and auto-immobilizing antibodies can develop against the own sperm in 3 to 5% men. So this can be the cause. Next, we are talking about infertility, and in the causes in the male partner, defective spermatogenesis. Then there may be undescended testes. That means actually the testes are before 9 months, they are in the abdomen. And during the delivery process, the abdominal testes are taken outside your human body in the scrotum. Why they are taken out from the abdomen? Because core body temperature will not make the normal spermatogenesis. For formation of the sperms, the body temperature should not be too high. And that's why they are kept away. The scrotums are always outside the body, not inside like a liver or spleen. This particular testis cannot remain there because that can damage that seminiferous tubules and sperms will not form normally, or sperm count will be less. Then there is a mum, parotitis. After that infection, some people, some patients, some young chaps, they get the orchitis, the inflammation of testes, and then spermatogenesis will hamper. Then there are some smallpox in the childhood. Now this is eradicated. Varicocele and huge hydrocele. This can also cause the impotency. Tight underwear, prolonged exposure to the heat, for example, truck driver occupation or furnace men, these affect the spermatogenesis by raising the scrotal temperature. We are seeing the problem of infertility and male partner problem, husband problem. Okay. Genital tract obstruction and inflammation like urethritis, epididymitis, mainly gonococcal. This is STD we have seen in the last video. Rarely tubercular also. TB is also possible. In hernia hyphae or hydrocele repair, vas ligation can take place. So be careful. Is there any structural obstruction is there? Coital factor. Even up to 5% men are completely ignorant the act of coitus, and thus the marriage is never consummated. Hymosis also can cause coital difficulty. Coital frequency too few or too many are not suitable. Okay. Now we are discussing the faulty female factors in the case of infertility. Systemic factors all over the body. Systemic diseases must be sufficiently grave, serious to suppress the ovulation process. Many women conceive easily despite pulmonary tuberculosis. They have TB, anemia, age after 35 years, obesity, but still maybe they can conceive, but very risky factors. These can give you the infertility. Severe anemia, TB, age over 35 years, and obesity are the hurdles to get the child. Endocrinopathy factors, Froelich syndrome, thyroid disturbances, then hypogonadotrophic amenorrhea, metropathic bleeding, Stein-Levels syndrome affect the infertility by unovulation or no ovulation. Next, we are discussing infertility, psychological factors, fear in the mind of either of husband and wife, nervous tensions, marital disharmony may affect fertility, perhaps through the tubal spasm and infrequent coitus, because wife and husband, they are not matching their wavelength and their thoughts are totally different, and when mind is not there, then you cannot perform physically also. Okay. Then genital factors, for example, of infertility problem, here you can see narrow vaginal introitus, then spasm, vaginismus, tight hymen, vaginitis, vaginal atresia or stenosis, high vaginal acidity, immediate escape of semen after coitus, that is fleur seminis, marked perineal relaxation may cause difficulty in coitus and insemination. We are talking about infertility. So we will discuss cervical factors, hormonal problems, anatomical problems, infective problems, neoplastic cancer problem, or immunologic factors can affect cervical mucus. Uterine factors, garbhashaya, uterine fibromyoma, adenomycosis, then meiosis, uterine hyperplasia, and tuberculous endometritis. Now we will go further. That is a tubal factors, for example. Sulfine, that centrally in the lower abdomen there is uterus. Then on the two sides, right ovary and left ovary. And then there are fallopian tubes. Tubes means fallopian tubes which connect uterus and the ovary. So there may be obstruction, tubal occlusion, or peritubal adhesion from salpingitis, gonococcal salpingitis, or pyogeny, or tubercular, congenital tubal defects, ovarian factors, chronic oophorytis, chronic cyst, and ovarian tumors. Now, secondary infertility factors. In the male, systemic factors are aging, diabetes mellitus, uncontrolled blood sugar level is high, obesity, heavy smoking, and alcohol. Endocrinopathy, hypothyroidism, adrenal hyperplasia, and psychological factors. Genital factors, hemorrhaphy, hydrocele repair, vasectomy, infective process in the urogenital organ or the tract. Next, female factors, secondary infertility, systemic factors like aging, obesity, endocrinopathy, thyroid problem, then metropathia, Sten-Leventhal syndrome, Sheehan's disease, and psychological factors. In genital factor, vaginal stenosis, cervical stenosis, cervicitis, prolapsed uterine Ashemar's syndrome, endometrial tuberculosis, post-abortal corneal block, uterine fibroid, very, very common, post-IUDC, intrauterine device for contraception, pelvic inflammation, ovarian tumors, pelvic endometriosis, and post-tubal sterilization. Next, we will do the investigations in the cases of infertility. What we can do first and foremost important is semen analysis. Don't disturb the female. Male should be checked first. Blood sugar, fasting, and PP for both the parents, male and female, to rule out the diabetes. You can do the HbA1c. Gynec checkup for female partners, endometrium biopsy of the female partner. Now next, what type of the advice we can give to this couple? Refer the patients to the specialist, allopathic or Ayurvedic or homeopathic. In general practice, primary education of the couple can be done and primary investigations can be advised. Primary education regarding the intercourse or the coitus, position, which day it may give the child, etc., etc. Diabetes, obesity treatment if that is underlying cause. If male and if there is a oligodyspermia, normal semen count is 80 to 120 milligram %. Now here there is a 60 millions per cubic mm or 20 millions per cubic mm, and less than 20 millions per cubic mm is called azospermia, no sperm, or oligodyspermia, less sperm. Suvarna Malini Vasanta 2 tablet 3 times in a day to stimulate the process of spermatogenesis. Himmatavati for muscular strongness. Hari Parshuram Aushadhale from Pune city, from Khadiwale Vaidya sir. 2 tablet 3 times in a day. Chandra Prabhat tablet 2 tablets 3 times in a day with milk. Rasayana Churna from Hari Parshuram Aushadhale from Pune city. The agency or the manufacturing pharmacy from Khadiwale Vaidya. Ashwagandha Churna 1 teaspoon at bedtime. Then Badam Kalpa 2 teaspoon at bedtime with milk. Now next prescription for the problem of infertility. Vasanta Kusumakara Rasa 1 tablet 2 times in a day. Makara Dhvaja, one best sex tonic, 1 tablet 2 times in a day with milk. Vanga Bhasma 50 milligram, Swarna Makshik 50 milligram, Ashwagandha Churna 1 gram, 3 times in a day with milk. Fortage tablet 2 tablets 3 times in a day with milk. Then if no pathology is found in the laboratory investigations, you can give this following treatment for infertility. Allersin company, Fortage tablet 2 tablets 3 times in a day for male. Aluza compound from Allersin company, 2 tablets 3 times in a day from the first day to the 14th day of menstrual cycle. Then Leptadine A, 2 tablets 2 times in a day from 14th day to the next cycle. So my dear friends, this is all about the sexual transmitted diseases and sexual illnesses in our medical general practice. Today, main topic that we have discussed is of course infertility, and before infertility, I have also discussed about erectile dysfunction or impotency. Sex Guide is a name of playlist available on my channel. Please check each and every video if you want to get a scientific but simple type of the information about the sexual activity. Then go and check each and every video. As usual, I would like to request that like, share, and subscribe my YouTube channel, and see you in the next video. Till then, let us have the healthy and happy life. Thank you very much. Bye bye.